Take one, quick.
Alrighty, good afternoon everyone. Thank you for having me today. My name is Callie Moore. I'm the Public Education Coordinator with the Alzheimer's Society of Sudbury, North Bay, Manitoulin, and Districts. So today I'm glad that you guys have invited me, and really my role here is to support family, caregivers, and community members by providing education about dementia and helping people feel more informed, prepared, and confident. I'm also currently a student at Laurentian University in the social work program, graduating in June, so I'm excited for that. And through both my education and my hands-on experience through our day program, supporting people living with dementia, I've developed a strong interest in this area, and I have the opportunity to see both the challenges and the meaningful moments that come with it. Some of you may have experience with dementia in different ways, whether that be through family members, friends, or within the neighbors within your community, or just simply noticing changes with people around you. Although dementia can be a scary topic, and sometimes it can be very sad to hear some of the realities that come with it, at the same time, educating and understanding it is important in order to help those around you. As of January 1st, 2025, an estimated about 700,000 people have been diagnosed with dementia in Canada. 414 people are newly diagnosed every day. It is projected that in 2030, there is going to be nearly 1 million people living with dementia in Canada. Although these statistics can be very scary, it is the reality of dementia and it is the reality of dementia. And it is difficult to hear, but again, it is important to put that message across because that means that more and more people around us may be diagnosed. So how can we best support these people, right? From here, we'll explore some simple practical strategies and help make everyday interactions with people living with dementia feel more comfortable, respectful, and meaningful for everyone. So I'm going to start by talking about what dementia is, what it can look like, and some of the changes that come along with it. With one of the biggest changes being communication. You might be asking yourself, why is this so important? And like I said, again, it is to gain more respect and dignity, to give dignity to the people that are diagnosed with dementia. The most important part is that dementia doesn't just affect memory. So it can impact parts of a person's everyday living, so daily activities, right? Including how they think, feel, behave, and interact with others. Understanding what dementia is and what it can look like helps us make more sense of those changes, as well as feeling less confused and unsure. It allows us to respond with more patience, as well as empathy and confidence, whether that's in a conversation or in our actions and how we support someone every day. When we have a better understanding, it can reduce frustration, and everyone involved can create a more supportive space and respectful environment. And ultimately, it helps us maintain connection, dignity, and quality of life for persons living with dementia, which really matters when we're in these moments, right? So I'm going to start by asking you guys a question, and feel free to just say the answer out loud if you know the answer. Does anybody know the difference between dementia and Alzheimer's disease? So when you hear those two things, what can you maybe differentiate the two? So a lot of people don't understand that dementia is actually an umbrella term, and Alzheimer's is a form of dementia. So there are over 100 types of dementias out there. And today I'm only going to go over the 4 most common types, as I don't think we have time to go over all of them. But dementia is not a specific disease. It is actually what we call an umbrella term, meaning it describes a wide range of symptoms that are caused by disorders affecting the brain. So these symptoms impact things like memory, thinking, communication, and the ability to perform everyday activities. Within the umbrella, there are several different types of dementia, and we'll briefly walk through these types. So the first and most common type that you guys have probably heard of is Alzheimer's disease. So Alzheimer's disease affects up to 80% of people with dementia. So Alzheimer's affects memory first, and especially short-term memory. And over time, it impacts thinking, communication, and your daily functioning. One of the earliest signs that comes with that is memory loss, and it begins, again, to interfere with everyday life. For example, forgetting important appointments or repeating the same question on multiple occasions. Other symptoms can include changes in judgment or personality and behavior. There is also a genetic form of familial Alzheimer's disease, but it is much less common, accounting up to 5% of cases. But I will go a bit more into that after I go through the other forms. Is there any questions for Alzheimer's disease? The next most common type is vascular dementia. So vascular dementia is the second most common, and it accounts for 20% of cases. So this type is caused by reduced blood flow to the brain. Can anyone assume or take a guess on what would maybe cause that? A stroke, yes. So a stroke is usually what causes conditions that affect the blood vessels in your brain, right? So it is important to note that not everyone that has a stroke will develop dementia, but it does increase your risk of developing vascular dementia. Vascular dementia often progresses in a step-by-step pattern. So someone may seem stable for a period of time, and then they'll decline, and then they might stay in that state for a while, and then they'll have another rapid decline. So unlike Alzheimer's disease, where it progresses slowly, vascular dementia will progress in a step-by-step pattern. And then Lewy body dementia. So this is your third most common type of dementia. So this one affects about 5 to 15% of cases. So Lewy body affects your cognition that looks similar to Alzheimer's disease, but it also can resemble something called Parkinson's disease. So Lewy body kind of intertwines with both of these. So in some unique things that are included with Lewy body dementia are hallucinations, paranoia, and sleep disturbances. So you may have heard something REM sleep disorder, and that can appear earlier on. Lewy body dementia is an umbrella term that includes Parkinson's disease and dementia with Lewy bodies. Is there any clarifications that can be made or any questions? And then there's frontal temporal dementia. So frontal temporal dementia sometimes refers to as Pick's disease, and that one accounts for 2 to 5% of cases. This type affects the frontal lobes of the brain, which control things like personality, behavior, and language. So instead of memory loss being the first symptom, we often see changes in behavior and judgment first. For example, someone may act in ways that are socially inappropriate or out of character. And it is also mostly common to be diagnosed under the age of 65. Can anyone take a guess about the age range of young onset dementia? Yeah?
40s.
40s? Any other guesses? So when we think of dementia, we often think it's an older person's disease. But the reality is you can be diagnosed with dementia as early as 18 years old. So no one is susceptible to being diagnosed with dementia, although it is less common to be diagnosed early on. We are now seeing more and more people being diagnosed with young onset. So from the ages of usually more common are 40 and 50s, but there's also some people that are being diagnosed in their 30s and even earlier on, so in their 20s. Yeah?
Is there any reason for this? Like, is it really living?
Yeah, so there's a lot of factors which we're going to go through a little bit, but that is a good question because why are we seeing so much increases in the dementia, right? And why are people being diagnosed earlier on? There's so many risk factors that come along with this, which I will go through, but a lot of them is within the diets we're eating, the environment, how we're stimulating our brain, so physical activity, socialization, so these things don't really help with that. So that's where we are seeing more and more people being diagnosed early on. The thing that's complex with dementia is that there is not one single thing that we can say is causing this, right? So there's so many different things and so many different people being diagnosed that have different life stories or different career paths and all these different factors to come into play that it makes it hard to pinpoint why are people being diagnosed so early on. Yes?
Are there more women than men?
Yes, so women, I will go through that as well. So women are more susceptible to getting diagnosed with dementia. I'll explain that a little bit more, but that is the reality of it. So the biggest risk factors are age, your gender, and then there's a few other things I'll go through. Yes?
What percentage of people with Parkinson's get the Lewy body dementia?
I don't know that one. I'll have to look into that. I'll do some research and I can get back to Beverly through email for the answer.
Okay.
Any other questions? In addition, there are many types that we have discussed, and there are a few forms of dementia these are the forms of dementia that are important to be aware of because they are the more common types. There are also different types of dementia that can come with alcoholism or other risk factors that come into play. There's also something called mixed dementia. So mixed dementia is when you have several types of dementia at the same time. Usually you'll have Alzheimer's disease and vascular dementia, which is the most common two to intertwine, but that's where it becomes very complex, right? So this is when a person has more than one type of dementia occurring at the same time. Most commonly the combination of Alzheimer's disease and vascular dementia, because symptoms can vary and reflect on both types of symptoms. And then there's the young onset dementia that I kind of already went through. Yeah.
Is society helping people recognize this more, or is it what we do or don't do now that it's been onset? Like you mentioned the phone.
Yes.
The lack of communication, the lack of interaction.
Mm-hmm. Yeah, I'm going to go a bit into the risk factors, but it's really on what we do on an everyday basis, but no one is immune to getting dementia. So you could do everything perfectly and still be diagnosed. And that's the scary part, right? You could be very stimulated your whole life, you could do all these things and still be diagnosed. That's why research in dementia is so important, because we don't understand why so many people are being diagnosed with this.
For women being identified or diagnosed more than men,
Yeah.
would it have something to do with the loss of estrogen in our 50s?
Yeah, so menopause does come into play when we look at women and dementia. So menopause is a big factor, but it's also due to our physical activity. So throughout life, women are usually told to not put as much muscle on, or to, there's different societal standards when you're a woman, and these health factors play a big factor in that. But there's so many different reasons behind that can become quite complicated.
Some of them social.
Yes, socializing, what we do for careers and things like that. But with time, we're starting to notice some changes in that, but also some more risk factors. Yes, sorry.
Just a gentle reminder that we will have a question period after, because this lovely lady here may answer the question before it is asked in her talk. So just a gentle reminder, we will have time to answer your questions. Okay?
Thank you. Yeah, sorry. I know there's a lot of questions, and it piques a lot of curiosity when thinking about dementia. So yes, like you said, I will go through any questions you guys have. But considering I am also new, I don't have all the answers all the time, but I will do my best to provide them, and if I can't, I will follow up by email and do that research, because it is important for me to know the answers as well. But yes, for women, many different factors come into play. When you look at the characteristics of dementia, there are three characteristics we like to use. So the first is that dementia is degenerative, so meaning there is loss of brain function over time. The second, meaning it is progressive, so the symptoms will continue to worsen. And then the third is that it is irreversible, because there's currently no cure when it comes to dementia. And what is happening to the brain cannot be undone. So as your brain cells are slowly, unfortunately, dying, these things cannot be reversed, and especially because there is no cure at the moment. This is why understanding and support and planning is so important, because as things progress, you'll go through different stages. When we look at the stages, we often describe them in 3 stages. So you have your early, middle, and late stage. So in the early stage, individuals may experience mild symptoms, such as forgetfulness, difficulty finding words, or subtle changes in mood and behavior. At this stage, people are often still very independent and aware of the changes that are going on to them. And that's where it's important to try and get that diagnosis, because we want to keep that person involved in their own care planning. So we want to best understand their wishes and what they want the future to look like. So having those early on discussions are so important, because it also takes that pressure off of you being as a care partner, right? So when you understand and have these discussions about what the reality is going to look like and what the person wants, the early stage is where we recommend to have those discussions. At this stage, people are often still independent and aware of the changes that are happening to them. So that's why it can be difficult for someone to kind of maybe accept, and that's where that denial comes in. So maybe when the driver's license is taken away. Well, why? I've been driving for 30 plus years of my life. Why are they taking my license away? But they are still kind of understanding what's happening, and that reality hitting them is very difficult, right? And us as people that are watching this, we want to just say, well, yeah, it's a risk out there, but imagine that was you, right? Put yourself in their shoes and try to understand how frustrating that's got to be. And then in the middle stage, so the middle stage is where symptoms start to become more and more noticeable. So memory and thinking will decline, and individuals will need more support with daily activities such as cooking, dressing, and managing finances. So this is where usually, that's why that early stage is so important, because once they hit that middle stage, things are slowly going to be declining, and they're going to lose those abilities that they're able to do every single day. This is where the care partner might start to feel more and more frustrated, because things that they used to help around with, let's say maybe one person always cooked and the other person always cleaned. Well, now that person's not cleaning after dinner. Well, why aren't they doing that? They've done this for my whole life when I've been with this person, right? That's where that frustration piece and that lack of patience and understanding starts to become more and more difficult. And understanding that what care partners are seeing is so very hard as well. So yes, the person living with is going through a lot, but so is the care partner. And I think that sometimes we overlook that factor, especially considering, there's less room in long-term care homes and retirement home, and supports are kind of declining right now. And care partners are expected to do so much. So memory and thinking continue declining, and all these things become harder to manage, especially finances. So at this stage, caregiving needs do increase for both support of the person living with and the care partner. In the late stage, this is when the person living with dementia will become fully dependent on others. So communication will become more and more difficult and very limited, and the 24-hour care might be required. So at this point, you kind of start to focus on shifting comfort and dignity, and as well as quality of life. And then unfortunately there is the end stage. So at the end stage, full care is required and the person living with will become non-verbal, and care again is focused on comfort and how well the person is being supported. Does anyone know what the age, how long someone can live with dementia? So what is that age, that range we usually give?
Around 10 years.
Around 10 years. So yeah, we like to say with research it's about 8 to 10 years. This is unique to everybody though, so everyone could go through this differently. It's not to say that someone diagnosed only has 10 years to live. This is with research that's been done, and that's kind of the time frame that's been given. But again, everyone's journey in dementia is different and unique to the person. So not two people will look the same. Everyone's going to go through this differently, and you can't say, well, this is what is happening to this person, so that's what's going to happen to this person, because everyone goes through it differently. So these stages are more so a guideline and not exactly what's going to happen, but that's what we like to use in order to kind of better understand the length of someone living with dementia. Is there any questions for this? No. Yes.
With PICS, it's usually less than 2 years though.
So young onset is usually a shorter time frame. 5 to 8 years is what we like to say. It is again unique to the person and how we manage through that dementia journey. So are they still trying to socialize? Are they still trying to do physical activity? Are they still doing these things to stimulate their brain, which can slow down progression, right? But yes, for young onset dementia, it is a shorter time frame because the symptoms that people go through with dementia are usually always, there's some things that are similar, but what will happen with young onset dementia is they'll have the same symptom as for people over the age of 65 that are diagnosed. They'll have the same symptoms, but in a shorter time frame. I'll use a quick bookshelf analogy. So this helps us better understand what's happening to the brain as someone is going through the dementia journey. So imagine the brain like a big bookshelf with memories and information. When the brain is healthy, all the books are organized and easy to find. As dementia begins, the books don't disappear right away. Instead, the bookshelf becomes disorganized. You can think of this like a storm starting to roll in. So at first, it's just a little bit windy and things are slightly getting out of place. But as the storm gets stronger and stronger, it shakes the bookshelf even more. The newer books, the one on the top shelf, are usually the ones that become harder to find and maybe even fall out of suit, and it's summer outside. Not recognizing medical issues that need attention because their brain is simply not telling them that their leg is in pain today. Or not giving away large amounts of money. So this is another common one. People will start to give money and you're thinking, why are they giving all this money away? They may not be able to use their judgment to understand that they don't have the money to share. Or making unsafe decisions such as wandering off in the bush. To them, they're simply going for a walk and they're going to start walking and then all of a sudden they're lost. They don't know where they're going. What is our first instinct if that happens? To try to find an exit. So they might keep going and keep going and keep going, but they're just getting further and further deeper into the woods. So this is often why we hear a lot of people are getting lost and wandering when they simply had it in their heads, I'm just going to go for a quick walk down the street, but they forgot where they were heading, and so they're just going to keep going because that's the only thing their brain is telling them to do. So that loss in judgment comes into play. There's also social withdrawal, so some individuals may begin to withdraw from social situations. This can happen because they feel embarrassed, overwhelmed, or unaware of some things that are changing. So that can happen to avoiding conversation, no longer participating in hobbies or activities, or pulling away from friends, family, and coworkers. Again, in that early stage, this can happen a lot because they're embarrassed about what's happening to them and they're still very aware of these changes, right? And I think anyone would maybe want to start, because of the stigma that's around dementia, that's when you start to see that, right? Because there's a lot of things that are misinterpreted or misunderstood. There's also hallucinations and paranoia. So in some types of dementia, especially Lewy body disease, a person may experience hallucinations or paranoia. So seeing people, children, or animals that are not there, believing someone is stealing from them, or becoming suspicious or fearful of others. The thing with this one is that this is their reality. This is really happening, and this is what they believe, and we will not tell them otherwise, and they will not believe you.
Okay.
So let's say I said, at the beginning of this presentation, you guys all told me what your favorite color was. And I kept going, okay, you really did. You guys all told me what your favorite color was. You guys did, you really did. But then all of a sudden, you guys are all saying, well, no, we didn't. What is she talking about? We didn't. But I truly believe that you guys did. You guys telling me that I did not might frustrate me because I truly believe that I did. So that is a good way to look at it. If they felt like they were stolen from, they were stolen from. So how can I redirect this? How can I maybe help them look at this differently? So that's where these strategies come in, right? So maybe trying to redirect them. So an example I like to use is one day I was working in our day program and a gentleman looked outside and he said, oh, my kids are getting off the bus. And I looked outside and I was like, there's no school bus there. What is he talking about? So instead of telling him, what are you talking about? There's no school bus there. I decided to say, oh, your wife is going to go get them. Let's go prepare them some lunch. So I brought him to the kitchen at our day program and we sat down and just started having a conversation. He forgot all about the bus that was there. But instead of frustrating him and telling him he was wrong and that bus was really not there, him and I just sat down and then it was a much more pleasant interaction than trying to argue with him and tell him that it really wasn't there, right? It's important to remember that occasional forgetfulness is normal, but what we're looking at here is when changes become consistent and start to interfere with a person's everyday life. Now we're going to quickly go through communication changes. So when someone is living with dementia, communication is one of the biggest changes we see. Dementia has a significant impact on a person's ability to communicate. So this is known as something called aphasia, which simply means the difficulty with language. So aphasia can affect several areas, including how a person expresses themselves, the words they use, their abilities to use the right words, and their ability to read and write. So communication changes are not just about talking, but they affect understanding, expression, and processing language. So yes, maybe these changes are happening to them, but what we do is what matters the most in order to help them communicate better. So individuals living with dementia may have trouble expressing their thoughts clearly or finding the right words, understanding what others are saying, and reading and writing like they used to. For example, someone you may know what you want to say, but you just can't find the right word, or they might substitute it with another word or description. As dementia progresses, through the early, middle, and late stages, these communication changes and abilities will gradually start to change. So in the early stages, changes might be subtle, like word finding difficulties. In the middle stage, it may become harder to follow conversation or express the needs they want. And in the later stage, communication often becomes more nonverbal. But it is important to remember, communication is always possible at every stage of the disease. It is what we do, again, that matters. So I'm going to ask you guys a question without looking at your book too much, although the answer is in there. How much of does our verbal communication count? So when you look at percentages, how much do you think our verbal communication counts? The answer is right there. So if you look at your pie chart in the booklet, 7% of the words we use is what matters. Everything else, so that 38 and 55% comes to our paraverbal communication and our nonverbal communication. So how we use our gestures and our facial expressions and how we say things, so our tone of voice. Verbalizing only means so much. So when speaking to someone, this doesn't even affect people with dementia. This means in general, so for everyone. So let's say I was up here and I was looking at you guys like this, then you guys might think I'm not happy to be here because I'm speaking very negatively and I'm frowning. So you guys might not be thinking, oh, this girl doesn't want to be here today. But the way I speak and the way I show my facial expressions, my gestures, is what matters more than the words I'm saying, right? So when speaking with people with dementia, this can also change the interactions we have every day. So even expressions that we use, like my pants are on fire, they might actually think your pants are on fire because they're having a harder time understanding that this is an expression that we use in Northern America, in the North, right? So that can become incredibly challenging for someone with dementia. As the disease progresses, you may notice the person creating new words or may use language that's out of character, such as swearing or just things that they used to not do on an everyday basis. So swearing or things that are out of character. So I feel like a lot of people bring that up. Oh my God, the person I know, they were always the happiest person and they would have never said a bad word, and now all of a sudden they're the most negative person and they're using all these bad words. Understanding why this happens is so important, but that's just the changes in their brain that are making them act in a way that we don't expect or that we don't recognize. And that can be incredibly challenging. So that's something we call ambiguous grief, right? So the person you love and you've known your whole life is changing, and they may not become someone you recognize anymore. And understanding that and meeting them at their reality is what's so important. They might also revert back to the language they first learned, so their mother tone. So someone who spoke French a lot when they were younger with their family, maybe they grew up in Quebec and they've always spoken French. Well, as they progress in the disease, they might revert back to only speaking in French. And that's because as the disease progresses, we are reverting back to what we know and not what's at the front of what we learned. So another example of that is the people that we interact with every day, and then the ones that maybe came along later in life, so maybe grandkids, or that they may not be able to recognize that person anymore because they haven't known them as long. Or they might start to ask about their parents because they're reverting back to what they first learned and what they first knew in life. Again, with language as well. So that gives us a better understanding as to why these behaviors or these personal expressions or these things are happening, because they're reverting back to all of these things. They may also talk less than usual or lose their train of thought, have difficulty following multi-step instructions, or struggle to make their speech understandable. In some cases, a person will probably stop speaking altogether due to these changes. Additional challenges are finishing sentences, staying on topic, or organizing their thoughts, understanding abstract language, like what I said about the pants are on fire, like I feel blue. They may not understand what you're trying to tell them there. Or again, interpreting our facial expressions, following along the conversation, or understanding jokes and humor that we use every day. Any questions here? All of these changes can be very frustrating, especially as a care partner or when you're observing these changes happen to someone you love. But it's not only upsetting for us, it can be very hard on the person living with dementia, right? So it's important to approach communication with patience, understanding, and flexibility. And again, even though communication changes, it does not disappear, and we just need to adapt how we communicate with the person we love or the people we know. Again, I went through this a little bit, but 7% of our how we communicate is our words, 38% comes from our tone of voice, and 55 to 58% of our communication comes from our body language. So it's really not about it's mostly about nonverbal communication, which means more for anyone in our everyday lives. For example, if I say, I'm here to help you, but I come in with a frustrated tone, so I'm here to help you. I have a hard time doing that. Or I avoid eye contact when I'm speaking to you guys. Or, my arms are crossed the whole presentation. But I'm saying the same phrases and I'm talking the same way, then you guys might have a hard time understanding what I'm trying to get across today. And that, for someone with dementia, is their reality. So this can become very important when supporting people with dementia. As verbal communication declines, they rely more on what we say and how we say it, so your tone of voice, your facial expressions, and your body language. They may not fully understand what you're saying, but they will pick up on your emotions, so that's a really good way to look at it. So if we appear rushed or frustrated or tense, they'll feel that. But if we come in with a calm and patient attitude, even reassuring maybe, they'll feel that too. In many ways, we are setting the emotional tone for what the interaction will be. All right. So now that we understand why these changes are happening, and I'll give you guys a few communication strategies that you can use in your everyday interactions with people living with dementia that would also build a more supportive space for them. So these strategies can make a big difference in reducing our frustration, but also the frustration for the person living with. Yes, we are human, and sometimes our patience can run out, but trying to use these strategies is what helps the most. So before we even say a word, there are a few things to keep in mind. First, always approach the person from the front. Due to the changes in the brain, a person living with dementia may lose their train of thought or their peripheral vision, and that can create something called tunnel vision effect. So if we approach the person from the side or behind, it can startle them or scare them. Making eye contact is so important, so this helps the person know that when speaking directly to them, it helps them focus and keep their attention. And third, reducing any noise around them, so reducing distractions. So try to have a conversation in a quieter space. Too much noise or activity can be overwhelming and make it very difficult for the person to process what you're trying to say. So I often think of really busy environments. I think a lot of us can even get overwhelmed with this, but especially when someone is having changes happening in their brain. If you're trying to have this normal conversation like you used to, it may not be as effective because you got to keep in mind this person is changing. Now when we look at how we speak, so when it comes to how we speak, speaking slowly, clearly, and calmly. There is no need to raise your voice when speaking with someone with dementia. This is not a hearing issue, it is a processing issue. So trying to present one idea at a time, and it's really important because dementia affects the brain's ability to process and retain information. So if we give too many instructions all at once, it can become extremely overwhelming and the person might give up altogether. So this is a good way to look at it. If you want to let that person keep their independence, how can I best support them to continue to do these things? Oftentimes, it's all about how we do things to help that person we love. So, for example, instead of saying, go get your coat, put your shoes on, and meet me at the door. Maybe we could try breaking it down into steps by saying, let's go get your coat, now let's go get your shoes, and then we can leave. And that might put it into better perspective for the person and understand what you're trying to do. Also, ask simple questions, so ideally yes or no questions. Instead of saying, what would you like to eat? You could say, would you like soup? This makes it easier for them to respond. And then what we do and what we say. So there's also some key things to keep in mind in how we interact. So always introducing yourself. So even though maybe this person has known you your whole life, especially as they progress, they may not recognize you anymore, and that's the reality of the disease. And although it might feel frustrating for you to have to do this, it might help that person a lot. So introducing yourself, even if you feel like the person should know who you are, it helps reduce anxiety and creates a safer space for them. If the person doesn't understand you, try rephrasing instead of repeating the exact same thing. So maybe the way I said it the first time wasn't effective, so how can I say it again for the person to better understand what I'm trying to tell them? Avoid correcting or teasing them. So oftentimes when you say something like, "Do you remember my name? You already told me that," can create embarrassment or anxiety for the person living with dementia. So instead, try to focus on maintaining dignity and connection. So you could help using that one sentence at a time, and one of the most important strategies again is to join them in their reality and gently redirecting them. If someone is confused or believes something that isn't accurate, correcting them can increase distress. So instead, we meet them where they are and validate their feelings and redirect if needed. We are not trying to bring them to our reality, we are meeting them where they are. So when we do that, we create a sense of comfort, safety, and trust, and that's really the goal of what we're trying to use when communicating with people living with dementia. Another example would be if someone says, "I need to go pick up my children," instead of saying, "Your children are grown, that's not true," we might say, "Tell me about your children, you must miss them," and gently redirect the conversation. This again reduces anxiety, and instead of increasing the situation to a level that may be uncomfortable for both you and the person living with, these strategies, although they even seem small, they can have a huge impact on the experience and the connection of the person living with dementia. When we look at treatable conditions, so it's important to know that not all cognitive changes are caused by dementia. So some conditions can look like dementia, but they're actually treatable, or in some cases, reversible. So a big one is depression. So depression, especially in older adults, can sometimes look very similar to dementia. So a person may appear withdrawn or forgetful or have a loss of motivation or difficulty with concentration. But this can be a symptom or look like symptoms of dementia or mimic dementia. But the right treatments and support of these symptoms can improve. So the reason I like to go through treatable conditions is because these things can cause fear in ourselves and thinking maybe there's something wrong. But going through this list and understanding this can help us go to the doctor and say, "I've crossed all these things off, now I think there might be something really wrong." So understanding these first are what's important, and especially when you're looking at other people. So there's also infections, so like delirium, especially things like urinary tract infections, or pneumonia. These can cause symptoms that look like delirium. So delirium is sudden changes in thinking, attention, or awareness. So a person may feel confused, disoriented, or experience hallucinations. So the key difference is that delirium comes on quickly and is often reversible once the infection is treated. There's also medication side effects. So when you take medications that maybe shouldn't be taken together, this can have an impact on the way your brain is functioning. So this might cause, again, confusion, memory loss, or drowsiness. So that's why medication reviews are so important, especially for older adults who are maybe taking multiple prescriptions at the same time. So having these conversations with your family doctor or your pharmacist are so important. Vitamin deficiencies, so vitamin deficiencies such as low B12 can impact your memory and thinking. The good news is that these can be identified through simple blood tests and can be treated. Sleep disorders, so sleep plays a big factor in our brain functioning. So conditions like sleep apnea or chronic poor sleep can affect focus and mood. So when someone is not getting the adequate amount of sleep, this can look very similar to a cognitive decline. So understanding that there's things that can cause changes in your brain that aren't dementia is so important as well. This is why proper medical care is so important, and before being diagnosed with dementia, a healthcare provider will try to rule out all these other things that could be possible causes. In some cases, what looks like dementia can just actually be something that can be treated or improved. This is also why we encourage people that if you notice memory loss or changes, don't ignore it and get checked. When it comes to getting a diagnosis, it can be extremely complex and can take a lot of steps and can be a very lengthy process. It depends on the person and the situation. So when it comes to getting a diagnosis, the process usually begins with your family doctor. So this is important for first steps because in different conditions can cause changes in memory, thinking, and behavior. So before the dementia diagnosis, we'll rule out the things I just talked about. In the initial assessment, the doctor will begin with including a full physical examination, so this helps rule out any physical symptoms. This, for example, infections can sometimes be sudden and can cause confusion, which may also look like dementia. There's also a look into your medical history and physical exam. So this can include looking at symptoms and when they started, how they've progressed, and your family history. Family members are often involved in this step, and because they may be the ones that have noticed these changes first. A physical exam is also done to check overall health and identify any underlying causes or medical issues. Testing, so in many cases, further testing will be done to better understand what's happening to your brain. So this can include blood tests to check for things like vitamin deficiencies or infections, brain images such as CTs or MRIs, PET scans, and EEGs. So these are all to measure what's going on in your brain and the activity in your brain. These tests also help us rule out other conditions such as tumors, injuries, and give a clear picture of brain health. There's also cognitive testing, so your MOCA test. So these are short assessments that are usually 20 minutes that look like memory, attention, and language and problem-solving skills. So the doctor will depend on these results for the individuals and specialists. There's also your neurologist that will be involved, the geriatric specialist, and your psychologist and the memory clinic for more in-depth assessments. And then there's the Alzheimer's Society that will be involved in your care planning, so I'll go over those programs and services. Once a diagnosis is made, the first next steps are developing a care plan. This can be done together with the healthcare provider, the individual, and their families. So this can help ensure the right supports and that they're done in the right places and that the person's wishes are often respected while moving forward in this journey. So overall, the diagnosis is not just one test and one process. The goal is to understand what's causing the symptoms, to rule out any other conditions, and make sure a person gets the right supports as early as possible. And that's why the support systems and services really come into play when we look at dementia, which I'll talk about next. So quickly, sorry, being mindful of time. If you guys want, you guys can do some research, or I can quickly go over them. Do you want me to?
No.
Okay. Okay. So our programs and services at the Alzheimer's Society. So we offer a wide range of programs and services to support both the individuals living with dementia and the care partners. Our goal is to provide support at the time of the diagnosis and throughout the journey. So our first step is usually the First Link Care Navigator. So our First Link Care Navigators are when the program connects individuals and families with our health services, health services in the community with education programs and ongoing support throughout the time of the diagnosis and the journey. So this really helps the person living with and the care partner feel less alone and navigate the next steps. And then we have our cognitive assessments. So again, that MOCA test. So our professionals do our MOCA test. So these are cognitive assessments to see where the person is at. Usually we say about every 3 months is what we would recommend, but these can it depends on the person and how much you would like. But they're completed through regulated professionals, and a referral is not needed. So they can be done in-home or at the Alzheimer's Society, and the results are then shared with your healthcare provider. We have something called BSO, so Behavioral Supports Ontario. So this is where our behavioral supports teams work with families and care partners, when a person living with dementia is expressing responsive behaviors. So these provide practical strategies and support and help people better understand and respond to the behaviors in a more effective way. And then there's support groups. So we offer support groups for care partners and people living with. So these are led by our trained facilitators that provide a space for individuals and care partners to connect with shared experiences and receive emotional support. And then we have different groups available for people living with and for care partners and for those who are newly diagnosed. So our coffee club is one of them, and then our support groups. And then there's Carers and Teach. So this is a psychotherapy-based program through Mount Sinai. So these are often structured and skill-based programs designed specifically for care partners. So these are interactive and provide tools and strategies for caregiving, and participants typically complete the learning series, which is what I facilitate, before joining these programs. Our learning series is our 4-week program, education-based program, so that covers understanding dementia, communication strategies, coping skills, and the available community supports. This is often one of the first steps we recommend when you have that new diagnosis. And then public education, which is also my role, so what I'm doing today, so educating our community through different programs. We also have something called dementia-friendly communities, which helps people get a decal to represent their agency or their agency really to be a dementia-friendly place and environment. In-home activation kits, so that is where our health promotion and rec therapy team comes in. So they go into homes and spend an hour with people living with dementia and make kits for people living with dementia to do activities that stimulate their brains, guided to that person and their personhood, which is a form they fill out in order to better understand who we are caring for.
We want to maybe move on to Q&A.
Okay.
Yeah.
Okay, sorry. I'll take question and answers now.
Is dementia or Alzheimer, is it family friendly? Like I have a few had a few in my family that were dealing, my partner had it for 5 years, so, and my sister just died and she had dementia, but she was in a nursing home. My aunt had it.
Sorry, repeat the beginning. I missed what you had said.
Is it hereditary?
So there is a familiar Alzheimer's disease, so that affects up to 5% of cases.